Many of you have heard me say we need to deliver the safest, most effective, best patient experience care possible. That's what differentiates an average or a good hospital from a really great hospital, and we want to be a really great hospital. We know though sometimes we let our patients down and we don't do for them what we say we will. They can be there from sunrise to sunset and we haven't delivered the care when we said we would. That's a red day, and that's stealing the day of a patient's life, and that's something they'll never get back again. The Red Green Day initiative is about eliminating those red days. Come and help us improve the patient experience.
A red day is when we plan for a patient to have something done, whether it be an image, a test, a surgery, and it doesn't get done for some reason.
So a green day means that anything that you've had planned in the hospital essentially actually occurs.
Allied health members as well as nursing staff gather around and they hand over as they would hand over ordinarily anyway, but they do it in front of a red-green screen, and if there's a patient with red cells identified, they'll look at those cells specifically and see if they can change them.
Going through those simple questionnaires to say, okay, why it didn't happen? And then to say, just to call the team and say, is there anything that we could do in the immediate team to say if we can rectify it?
If you identify the issues and take them to the appropriate level, and there's drive and willingness to push them through, you can actually move some of the blocks and get things moving. And that's great for patients because they get their care, they get in and out of hospital quicker, they're not waiting around for things to happen, and it's great for the system because we've then got more beds to deal with the next patients who are coming in through emergency or waiting for elective procedures.
Because we run at the same time as Journey Board, everybody's there, we're not wasting anybody's time, there's no extra time spent doing Red Green Day. We had the pharmacist do it yesterday for us, we've had the dietitian do it, and we did 18 patients in 8 minutes, so it's very, very quick. It's an efficient way of using our time.
A lot of the time when a patient had a red day the previous day, we'll make sure that we'll call early in the morning and we'll use a whole team approach. So whether we need to talk to the registrar, the consultant, or someone like a NUM to actually help coordinate that.
It gave us an opportunity not only to look at what is the plan for the day, but then to institute a second review at the end of the day and say, right, did it happen? So we actually thought, well, we'll take this and do it twice a day, because that way we really can set the person up for the following day in advance with that sort of focus.
We celebrate every green day that we have for our patients, and so once we finish the summary, every green patient I'll announce, we've got only 2 patients having red days today, or all of our patients are green patients today, they're all getting the right care at the right time. So we celebrate that as a team.
The most important thing is we respect someone and we value their time, and if we waste their time, we are disrespecting them.
It's given us ownership and given us power to actually talk about why patients are staying in hospital longer than they need to, and talking about what things are actually holding up patient care. So I think it means that we can actually work together and we have transparency between us and all the other members in the hospital about what's holding us up, and then give us tools to actually work forward to get better possible outcome for our patients.
It gives you an opportunity to look at what the day's work is at the sunrise, check it at sunset, and say, have we achieved the very best we can for this person today?
Ultimately, Red Green Day is about not stealing the day of a patient's life. We all have a role to play in the patient experience.